Hey folks, Doug Blake with Body Design University. In this video, I want to talk to you about the tables in chapter 13, beginning with table 13.1. And this is going to kind of begin the start of tables that give you exercise guidelines for clients with these particular chronic diseases. So chapter 13 itself is considerations for clients with chronic disease. Sometimes this is one of those chapters that can be a little bit challenging, a little bit confusing for trainers, because at the end of the day, we're personal trainers, not clinicians. We're not therapists. Obviously, we're not doctors. But it's almost when you go through this chapter, you get this feel like Ace wants you to kind of be thinking in that light. Now, I will say this: if you do have the education, you have the training, and in some cases the experience, you can actually use some of this material to your benefit, depending on the market that you're dealing with. But clients with chronic diseases and these conditions that ACE is going to go over with you obviously requires, and ACE tells you this, by the way, it requires clinical care. It requires a primary care physician or some other clinician that is dealing with the individual's actual disease. Now, I will say this: I would always take references, guidelines, and considerations from the clinician if it was related to like cardiorespiratory training, for instance. So if you got a cardiologist that is telling their patient, your client, for instance, you may want to be doing 3 to 4 days a week of exercise. Get with a trainer. In that case, I don't really need them telling me a whole lot. I've got the guidelines for individuals that have had some sort of cardiac event or they have hypertension. Again, the idea is that we want to be careful in this chapter. And like I say, because students ask me all the time, how much should I be doing? Should I really be looking at clients like patients in a way? And the answer, of course, is no. So chapter 13 can be a little bit confusing, and I get that. What ACE wants you to keep in mind is that outside of what clinicians do, now it falls on the ACE certified trainer to kind of take on I guess you could say, the mantle of responsibility to help them through and dealing with these chronic diseases. I believe ACE is probably, at least when they wrote the textbook, they're kind of looking into the future and trying to help and assist personal trainers in the fitness industry to get a little bit closer, more connected to the clinical world, which I don't think is an issue whatsoever. Sort of that crossover gray area of individuals that are being taken care of in the healthcare system in any way, shape, or form, and trying to navigate back into, quote, normalcy, I guess you could say. But chronic conditions are chronic conditions. Remember, you never technically get rid of a chronic condition or disease. You simply manage it. Okay. So with that in mind, ACE gives you chapter 13, and I would, for all intents and purposes, read through it real well and understand what ACE is trying to help you to understand is important. Whether or not you actually utilize this information in the real world. By the way, I'm not sure you're going to see a ton of people with all of these conditions that really need you writing soap notes for them. I don't think that's really the case, but ACE gives it to you. And like everything else in their textbook, they are giving you basically recommendations, and they're setting the bar pretty high. So that's good. Um, Chapter 13, cardiovascular issues, coronary artery disease, hypertension, stroke, PAD, peripheral arterial disease. All of these are common in today's world, common chronic diseases. Collectively, when you look at a bunch of these, we call them metabolic syndrome, and you'll see that under metabolic disorders. But what I wanted to do is give you kind of an idea of strategies to memorize these tables. And so as you move through the beginning of the chapter, they got a lot of information. Obviously, they're going to get to the cardiovascular and cerebrovascular disorders, cerebrovascular, and you're going to get to table 13.1, which is on page 599. So if you open your textbook with me to that page, you hit the first, like I already said, the first of multiple tables that basically give you the fit and progression um, components for how you would train somebody using cardiorespiratory and muscular training. Generally, as soon as you get a table like this, your goal is to rewrite the table. And that's why this tip is going to be helpful. Instead of rewriting the entire sentence that's a bullet point, you got to sort of compress it down to one or two words. And the better you get at this, the easier you will find you can do it, and the better you'll be able, the quicker you'll be able to memorize the terms. And so in the case of table 13.1, we're talking about the first chronic disease, which is cardiovascular disease. And again, FITTP, frequency, intensity, time, type, progression. This is how you do it. You grab yourself a sheet of blank paper and literally draw a table just like this one, and you are going to literally rewrite the entire table. And I know some of you are probably saying, oh my God, that's a lot to. Well, if you do it, and you do it once or twice, you actually memorize it better than if you kind of read it, go all the way through. You're going to have to come back. Better just to put the time and effort in up front. You'll be able to memorize the material better. So basically what you would do, draw out your box and put down exactly what they have, FITTP. So frequency, intensity, time, type, and progression. Now look over to the box that has the particular bullet point. Under frequency, you'll notice, and you're going to do this with every table that you go through in the chapter. Frequency, at least 3, but preferably 5 or more days of the week. Now, that's a full sentence. In order to kind of compress this down to as few words as possible, but while maintaining the meaning, I would simply write 3 to 5. And I may write days or days/week, but for sure, I'm just going to write 3 to 5. And that's it, 3 to 5. And I know that means days per week for frequency. If it's frequency, frequency is the number of days per week by definition. Okay. So I don't need to write down, look, 3-5 is a lot easier to memorize than at least 3 and writing all that down. So squeeze it down, compress it down to as few words as is possible. So frequency, 3 to 5. Clients with limited exercise capacity can perform short 1 to 10 minute sessions daily as needed. So again, how would you kind of compress that down? Limited exercise equals, I like to use like an equal sign to denote the definition or what it is. So limited exercise, 1 to 10 minute sessions. That's what I would write. And that's easy to memorize. So 3 to 5, 1 to 10 minute sessions, limited exercise. See, what I've done is I've compressed it down. And that's what I would do. And in this case, table 13.1, I'm literally giving you the way I would write it to make it easy for memorization. Intensity, moderate to vigorous intensity, mod, right, to VIG, VIG. I don't have to write intensity because I got the word intensity there. So intensity equals mod to VIG, moderate to vigorous. Intensity may be determined through the following methods. I don't need to write that. I don't need to write that part of the bullet point, but under that bullet point, the sub bullet point is with an exercise test, use 40 to 80% heart rate reserve or VO2 max reserve or peak VO2 max. Now you can write those down. So moderate to VIG intensity. And then my next one below that would be 40 to 80% HRR. You can't get around it. You got to write those out. Without an exercise test, okay, you can write the word exercise and put an X through it. That's the way I would do it. It helps me to understand no exercise test. RPE equals 12 to 16. Nobody uses that scale. That's the Borg scale, by the way. I'm not even sure why they still have that. Probably in their 7th edition, they will review that, get rid of it. Nobody uses the Borg scale anymore unless you're doing research. So the 1 to 10 scale is the normal way to do this. Again, nobody uses the 6 to 20 scale. That was Borg that did that, and it was all research based. Or add 20 to 30 beats per minute to resting heart rate. However you want to put that together, you would just write that down and compress it all the way down. Next one, heart rate should remain at least 10 beats per minute below the heart rate associated with the ischemic threshold, if exercise ischemic threshold has been determined. Seriously? Heart rate should remain at least 10 beats per minute below. So you don't have to write should remain at least. You basically say heart rate less than 10 beats per minute. And then you could add on to that ischemic threshold. You got to decide what verbs and adjectives you need when you're crushing this material, when you're crushing the sentence down. Because again, if you look at it a couple of times, you will trigger the memory of that very sentence. That's the idea when you do this sort of this method of getting rid of all the extraneous words in the sentence. The last one here with intensity is high intensity interval training, HIIT, may be a safe and effective method for enhancing CR fitness for individuals with stable disease and a base level of conditioning. So HIIT equals stable disease. That's what I would write. That's all I would need, because that tells me everything I need to know. Base level of conditioning would be sort of assumed under there. So high intensity or HIIT, HIIT training, you could write good with stable disease, something like that. Basically, what I've done is I've taken 20 words and I've crushed it down to 4 words. Time, eventual goal of 20 to 60 minutes for cardiorespiratory training. I don't need 4 respiratory training because that's the chart we're on. So I don't know why that's even in there. Eventual goal, I don't need that word. Eventual goal of, no, just write 20 to 60 minutes. That's the time, 20 to 60 minutes. That's the memory that you want when you're asked a question about this. Warm up, cool down. Activities lasting 5 to 10 minutes should be included in each exercise session. Do warm up, cool downs, 10 minutes, 5 to 10 minutes. That's all you need. Type, rhythmic, large muscle group exercise that emphasizes whole body conditioning. Large muscle group activities, by definition, emphasize generally whole body type of conditioning. Squats, although you're not working the upper body, is a large muscle group exercise. Pull-ups, rows, multiple compound movements are large muscle group exercises. And that does emphasize whole body conditioning, so I don't need to write that. And utilizes multiple activities and pieces of equipment. Okay. Now, right off the bat, large muscle groups. That'd be it. Or whole body activities, whole body condition, if you wanted to write it like that. Me, I would just write large muscle groups or train large muscle groups, something like that. Arm ergometer, right? That's that UB machine. Upright recumbent cycle ergometer. Nobody uses an ergometer as a trainer. Recumbent stepper, rowers, ellipticals, treadmill for walking. If you have to write down the most fundamental cardiorespiratory pieces of equipment, and then write it down. But I would hope that for most of you, you already know what these exercises are. There's biking, there's elliptical, there's treadmills, there's things like that. Arm rowers, UBs, if you got them, recumbent stepper. So that's the type. See, what you've done is if you look at table 13.1, which takes up 3/4 of the page, 599, I can squeeze that down to where it's literally, this much of the page, because I'm getting rid of all those extraneous words. So progress following the ACE integrated fitness training model based on client goals and availability. I wonder if you're going to see that on basically all of their tables and charts, or some facsimile of it. If it is, you don't have to memorize it for each one of those. You know that it's simply going to be a part of it. So progress, IFT model. Use IFT model for progression. Sessions may include continuous or intermittent exercise. Okay. Continuous or intermittent. You don't have to write the word exercise. I hope that makes sense. When you're when you're trying to memorize, remember, if you're actually going to use this after you're done and you passed your exam and you're actually going to go back into chapter 13 and grab this and look at it, well, that's great. You have it right in front of you. But from a testing perspective, you don't want to do that. You don't want to spend a ton of time trying to memorize a lot of extraneous words that aren't going to help you anyway when it comes to the testing. Squeeze it all down. Do that for all of these tables. Obviously, and I'm just going to go with you here, muscular training, you just got a lot of numbers. You're just memorizing numbers. That's continued over on page 600. Let's see, hypertension. Okay. Progress. See what I told you. Progress following the ACE integrated fitness training model based on client goals and availability. Okay. It's the same thing for pretty much each one. And so you're going to do the same thing with table 13.4. Squeeze it down. Stroke. Let's take a look. Progression is the same as the other ones. Follow the ACE integrated fitness training model. You keep going, table 13.6. Kind of the idea, hope this makes sense, is that when you're trying to memorize this information, you don't want to make it any more difficult than it needs to be. Try using that technique of squeezing this material down to 1 or 2 words, 3 words at most. Because what you'll do, or again, numbers, because what you're doing is you're creating a scenario where once you've read the entire sentence, you know what the sentence says, but now you're basically squeezing it down so that when you look at the shorter 2 to 3 words, that's what triggers the response, memorization response, and you'll know what it's talking about. Again, if you need any help or assistance, just put it in the comment section below. In fact, if you've gone through the video, it helps you write the word understand. And if you try doing it and it does work for you, then give us another comment and let us know. That's always very helpful. As always, have a great week. We will see you next week.